Have you ever experienced your body feeling trapped in alarm, racing heartbeat, tight muscles, a whirlwind of thoughts, even when there isn't any real threat? What you're encountering is not merely stress, it's your nervous system caught in survival mode. Today, I'm going to show you how to reset it using neuroscience-backed techniques. Before we get started, I'd like to clarify. While I have explored this subject and consulted with professionals, this video is meant for educational purposes, not medical guidance. Let's begin by examining what occurs within your body during moments of dysregulation. Your autonomic nervous system operates in three primary states, articulated by Dr. Stephen Porges's polyvagal-theory. Ventral vagal, rest and digest, your state of safety. Here you feel at ease, connected, and able to interact with others. Sympathetic, fight or flight, your response to threats. Heart rate accelerates, digestion slows, and you are prepared for action. Dorsal vagal, freeze, your emergency halt. You experience numbness, disconnection, and paralysis. These responses were developed for our survival, yet modern circumstances often leave many individuals trapped in sympathetic activation or cycling between states in counterproductive ways. A 2023 article in the Journal of Neurophysiology indicated that prolonged sympathetic activation is associated with inflammation, digestive complications, and possibly hastening the aging process. The encouraging news? Research illustrates that we can consciously transition between these states using particular techniques. Let's examine 5 evidence-based approaches you can implement today. Our first method actively engages your parasympathetic nervous system through breath control. This is how to do it. Position one hand on your chest and the other on your abdomen. Inhale slowly through your nose for a count of 4, feeling your abdomen rise. Exhale through your mouth for a duration of 6 to 8 counts. Repeat this cycle for a minimum of 6 breaths. The scientific efficacy of this technique lies in the prolonged exhalation. A 2021 study in Cell Reports Medicine determined that lengthening your exhale more effectively stimulates vagal tone compared to inhaling and exhaling for equal lengths. The study found that just 5 minutes of this breathing technique led to a reduction in cortisol levels by as much as 23% when compared to regular breathing. Note: ensure you find this practice comfortable. If you begin to feel dizzy, reduce the counts while keeping the longer exhale ratio intact. The second strategy we will explore is rooted in trauma therapy and somatic practices. When your nervous system is out of balance, it actively looks for dangers. We can disrupt this pattern by consciously focusing on safety cues present in your surroundings. Here's the approach. Stop your current activity. Take a slow, thorough look around the room. Identify 5 items that convey a sense of safety. Observe the colors, textures, and comforting objects. Let your focus settle on these safe signals. Research led by Dr. Peter Levine indicates that engaging in this practice enables your mind to acknowledge, "I am safe now," prompting your nervous system to transition from a sympathetic state to a ventral vagal state. A study published in Frontiers in Psychology in 2022 revealed that regular exercises in orienting enhanced heart rate variability, a crucial indicator of nervous system adaptability, by 18% over a 4-week period. This method is particularly beneficial because you can practice it anywhere, even in public, without drawing attention. The third strategy focuses on directly stimulating your vagus nerve, the primary communication channel for your parasympathetic nervous system. Consider these 3 research-supported techniques. Cold exposure. Splash cold water on your face for 15 to 30 seconds. This activates the mammalian dive response. A 2022 study in BMC Neuroscience indicated that this method decreased sympathetic activation by 27% in just 60 seconds. Humming, singing. Humming or singing a simple melody for 1 to 2 minutes. The vibrations stimulate the vagus nerve as it passes through your vocal cords. Studies show this enhances heart rate variability, which is a sign of parasympathetic engagement. Vestibular activation. Perform gentle side-to-side head movements, 5 to 10 slow repetitions. This activates the vestibular system, which connects directly to your autonomic nervous system. Research from 2020 demonstrated that this approach lowered anxiety markers in individuals with panic disorder. I personally keep a small ice pack stored in my freezer for times when I feel overwhelmed, as this cold exposure technique has proven to be transformative during episodes of intense anxiety. The fourth strategy centers on re-establishing a connection with your body through purposeful movement. In times of stress or trauma, we frequently become disconnected from our physical sensations. Embodiment practices help reverse this disconnection. Here's a straightforward yet impactful technique. Rhythmic movement. If possible, stand up. Initiate gentle, rhythmic movements, swaying, rocking, or walking. Concentrate on the feeling of your feet making contact with the ground. Gradually amplify the weight or pressure you feel through your feet. Continue for 2 to 3 minutes. Research by Dr. Bessel van der Kolk shows that rhythmic bilateral movements facilitate the reorganization of neural pathways disrupted by stress and trauma. An intriguing study from 2021 in the Journal of Psychiatric Research revealed that 10 minutes of rhythmic movement increased GABA, a calming neurotransmitter, levels by 15% compared to static exercise. If standing isn't an option, you can modify this by tapping your hands on your thighs in an alternating manner while seated. The final technique may come as a surprise since it involves social connection, approached from a neurobiological perspective. According to the polyvagal-theory, our nervous systems are designed to co-regulate. Essentially, when another individual is in a calm and balanced state, it can positively influence your own nervous system. Here are some specific methods. Vocal connection. A short phone conversation with a supportive individual can alter your state through tone of voice. Eye contact. Spending 30 to 60 seconds engaging in friendly eye contact with a trusted person activates your social engagement system. Close physical presence. Sitting shoulder to shoulder with a safe individual triggers co-regulation pathways. If you find yourself without anyone at that moment, studies suggest that simply envisioning a supportive relationship or viewing pictures of loved ones can engage similar neural circuits. A 2023 meta-analysis published in Psychological Bulletin reviewed 212 studies and revealed that positive social interactions enhance vagal tone and diminish inflammatory markers linked to sympathetic activation. This explains why isolation frequently feels uncomfortable. As humans, we are biologically designed for connection. Now that you are familiar with these 5 strategies, we can discuss how to put them into action. Consistency is crucial. Just like with physical fitness, the ability to regulate your nervous system better develops through regular practice. Here's my advice. Morning routine. Engage in 2 minutes of diaphragmatic breathing. Throughout the day, perform brief orienting practices whenever you sense tension. Post-work, dedicate 5 to 10 minutes to movement that embodies mindfulness. Evening. Engage socially. This can even be virtual. Acute situations. Utilize vagus nerve stimulation as needed. A 2023 longitudinal study indicated that individuals who applied regulation techniques for just 10 minutes each day experienced a 32% enhancement in nervous system flexibility after 8 weeks in comparison to controls. Keep in mind, your nervous system has developed its current patterns over years or even decades. Be patient throughout this retraining journey. Thus, here are 5 scientifically supported techniques to help regulate your nervous system. Diaphragmatic breathing with an extended exhale, orienting to your environment for safety. Stimulation of the vagus nerve. Practices that promote embodiment, engaging socially. These methods exploit your body's inherent potential for self-regulation. With ongoing practice, you can cultivate greater resilience, decrease anxiety, and enhance your overall well-being. If you're facing significant dysregulation due to trauma, keep in mind that these strategies are most effective when combined with professional assistance. If you found this video beneficial, consider subscribing for additional science-driven wellness content. I welcome your comments on which technique resonated most with you. Until next time, remember your nervous system is incredibly adaptable. With the appropriate tools, achieving balance is within reach.